Creatine. It is one of the most essential components of the phosphagen system. Creatine is used to produce short energy bursts in the muscle, which is especially important when performing strength building exercises. Studies have shown that creatine is also linked to an increase in fat-free mass and strength. However, most of the studies being performed are mainly focusing on the creatine supplementation. It is also important to note that protein glucose has shown similar results and effects on the fat-free mass and strength increase. With that said, researchers at McMaster University have hypothesized that protein glucose and creatine glucose will both have an increasing effect on fat-free mass and strength. Their study consisted of putting 23-year-old healthy men through an 8-week program where they would exercise and focus mainly on strength while also receiving supplementations at the end of their exercise. One group will be assigned to take a protein supplementation, which will include protein and glucose, and the other group will have a creatine supplementation, which will include creatine glucose.
A pre and post testing conducted over an 8-day period. On the first day, strength training was conducted of the legs, the second chest and back, and the third arm and shoulders. On the fourth day, a strength and fatigue test of the knee extensors was conducted, and days 5 through 8, no exercise was conducted, and instead a pre-packaged diet was given to the participants. For the next 8 weeks, the participants worked out for 6 days, and out of those 6 days, 5 of them were supervised. This ensured reliability and validity, and to also emphasize that the participants only used machines. Afterwards, muscle and plasma samples were taken, and these muscle samples were tested for ATP, phosphocreatine, and creatine levels. In addition, the muscle samples were tested and stained for myosin ATPase activity, which allowed the identification of the area and the number of type 1 and 2 fibers. The statistical analysis used in this experiment were an ANOVA and a two-tailed t-test.
Here are the results for different groups. In creatine carbohydrate group, we see an increase in body mass and also creatine concentration in the plasma and the muscle. In protein carbohydrate group, we see an increase in energy, protein, and carbohydrate intake for the first 2 months. But in both groups, we see an increase in body mass, fat-free mass, muscle fiber areas, 1 repetition maximum exercises, and the plasma AST. We also see a decrease in fat mass and the serum CK in the plasma. But there is no effect, absolutely none, on the nitrogen concentration.
The finding mentioned in the discussion section is that both supplements showed similar results in increase in strength and muscle fiber area. However, the increase in total mass was higher in value in the creatine supplement. Based on these results, both supplements could be recommended to athletes depending on the sport that they want to play. If an athlete wants high strength and lean mass, they should take the protein supplement. If an athlete wants high absolute mass, they should take the creatine supplement. Based on this research, athletes are better able to distinguish and evaluate which supplements would help them in the level of performance.